There are various eponyms, signs, and syndromes in otorhinolaryngology which an ENT postgraduate must know. These are Aquino's sign. Aquino's sign is the blanching of the tympanic mass with gentle pressure on the carotid artery. This is seen in glomus tumors. Here is a glomus occupying the middle ear. It is also described as cessation of pulsation of a glomus tumor with ipsilateral compression of the carotid artery. Basil sign. Basil sign is bruising behind the ear at the mastoid region, and this is due to petrous temporal bone fracture, namely a fracture at the middle fossa level. Here you see the Basil sign with bruising at the mastoid region. Basil sign is a clinical indicator of a base of skull fracture, and this is named after Dr. William Henry Battle, who was an English surgeon. Basil's sign. Basil's sign is described as inflammatory edema at the tip of the mastoid process in mastoiditis. Here we see the edema at the tip of the mastoid process. This was described by Frederick Basil, 1842 to 1908. He was a German otologist and professor at the University of Munich. His several contributions include Basil's abscess, Basil's mastoiditis, Basil's sign, Basil's test, Basil's triad, and the Basil-Edelman continuous scale. Boca sign is absence of postcricoid crepitus or crackle, also known as a Mewes crackle, in carcinoma of the postcricoid area. Brown sign refers to blanching noted when applying positive pressure with a Siegel's speculum to the tympanic membrane of a patient with a glomus tumor. Bryce sign. If a combined laryngocele internally and externally are present as a neck mass, compression will cause a hissing sound as the air escapes from it into the larynx. This is dangerous to perform since, in case of a combined laryngocele, air can escape from the external component, get forced into the internal component, thereby causing acute airway obstruction. This is a picture showing a combined laryngocele. Delta sign. Delta sign happens when, in a case of lateral sinus thrombosis on a CT or MRI, with a contrast, shows an empty triangle appearance of the thrombosed sinus surrounded by contrast enhanced dura, since contrast may flow around the clot to outline the periphery of the sinus. It is also called as the empty triangle sign. Here we see a picture of the delta sign in lateral sinus thrombosis. This MRI shows a left-sided lateral sinus thrombosis. Note the enhancement consistent with flow in the right lateral sinus, but absence of enhancement in the left lateral sinus. Dot sign, also called the crescent sign. Dot sign is an X-ray finding which is a crescent of air between the mass and posterior pharyngeal wall, which is seen in antrochoanal polyp. This is negative in angiofibroma. Furstenberg's sign. This is positive in encephalocele. Owing to the intercranial connection, there is pulsation and expansion of the mass with crying, straining, or compression of the jugular vein, and this is called the Furstenberg's test. This is used to differentiate nasal encephaloceles from other congenital midline nasal masses like nasal gliomas. Greisinger's sign is edema and erythema posterior to the mastoid process, resulting from septic thrombosis of the mastoid emissary vein and thrombophlebitis of the sigmoid sinus and lateral sinus thrombosis. It was described by Wilhelm Greisinger, who was a German neurologist, July 1817 to 1868. Hitzlsperger sign is in acoustic neuroma, where there is loss of sensation in the posterior superior part of the external canal, supplied by the Arnold's nerve, which is a branch of the vagus nerve to the ear. Holman-Miller sign, also called the Antral sign. Herein there is anterior bowing of the posterior wall of the maxillary antrum, and this is pathognomonic for juvenile nasopharyngeal angiofibroma. Hondusa sign. This is an X-ray finding in angiofibroma indicating infratemporal fossa involvement, characterized by widening of gap between the ramus of mandible and the maxillary body. Henneberg's sign. It is a false positive fistula test when there is no evidence of middle ear disease causing fistula of the horizontal semicircular canal. It is seen in 25% cases of Meniere's disease or congenital syphilis. In 25% of cases of Meniere's, fibrous bands form connecting the utricular macule to the stapes footplate. In syphilis, due to a hypermobile stapes footplate, it also manifests. It is called a Henneberg's sign when pressure-induced nystagmus happens. It's called Henneberg's symptom when a pressure-induced dizziness happens. Irving-Moore sign. This refers to the positive squeeze test when the substance of the tonsil is pressed with a tongue depressor. Pus or debris can be expressed from the tonsillar crypts, and this is seen in chronic tonsillitis. Log-ear sign. Log-ear sign refers to blood behind the eardrum, and this is suggestive of a basilar skull fracture. Ludet's sign. This is a condition in which, as a consequence of inflammation of the eustachian tube, producing a bright clicking sound heard by the examiner through the otoscope, while the patient experiences it as tinnitus. Ludet's sign is caused by reflex spasm of the tensor palati muscle. Lighthouse sign. When there is a small pinhole perforation with a pulsatile ear discharge and it looks like a bright flashing point of light from a lighthouse, this is seen in acute suppurative otitis media, often suggestive of a mastoid reservoir. The lyre sign. Splaying of the carotid vessels at the junction of the internal and external carotid artery, making it look like a lyre, which is a musical instrument and happens in carotid body tumors. This is a picture of the lyre sign, resulting in splaying of the internal and external carotid artery, making it look like the musical instrument referred to as the lyre.